Hi, everybody. So I'm Ryan Marino. I am coming from the United States, and I want to talk about some misinformation and our experiences with synthetic opioids. And I think Kirsten asked me here because of the concern that synthetic opioids are moving into other places, moving into Europe and Scotland in particular. And so I could talk for hours, honestly, about the lessons learned from misinformation and mistakes made in United States drug policy. I'm going to try to be mindful of everybody's time today and not do that. And so might be kind of moving through these slides quickly, but I think the rise of synthetic opioids has a lot of lessons, and hopefully people can not repeat the same mistakes that we have. I love this quote from Winston Churchill, because Winston Churchill never actually said this, but so hopefully we can learn some stuff today. I have nothing to disclose. I think everyone is aware that the United States, North America, and most of the world at this point is experiencing significant problems related to drugs, and particularly synthetic opioids. My kind of spiel here, if you will, is to give a little historical context. And so in terms of the United States experience, I think most people, if you ask them this question, when did our quote-unquote opioid epidemic begin, would say within the past 10 years, 20 years, maybe even 30 years. But it's important to remember the historical context that non-medical or recreational use of opioids dates back at least as far as 5000 BC. And this is literally recorded in stone, the cultivation of opium poppies. And so in terms of the United States experience, what the ancient Sumerians have to do with that, I will get to. But so historical context is important. Fentanyl didn't come out of nowhere. Our synthetic opioid crisis didn't just come out of nowhere. It isn't from the past 10 years. It isn't from the past 30 years. Morphine was actually introduced in the early 1800s. It was the first medicine ever synthesized from a plant, interestingly enough, as a cure for problems related to opium use, which is something that people had been searching for centuries before that point. It was much more potent than opium, and that's kind of a recurring theme in terms of opioid problems and drug problems in general. It was commercialized very successfully, used as a medicine. It's still used as a medicine today. Morphine isn't something that we think negatively about per se, but at the time, morphine became a big problem. Even the discoverer, synthesizer, whatever you would call him, spent most of his later life trying to warn people against morphine. And so this gets to the United States experience because we had a very bloody, disastrous civil war shortly after the development of morphine. And morphine kind of revolutionized the treatment of battlefield injuries in a way, but it led to an estimated hundreds of thousands of Americans using opioids non-medically. We can't say that these were truly addicted because the historical data doesn't give us that information, but this was something that was quickly capitalized upon. People knew that people like using drugs. People have always been using opioids, and so this is something that became a big problem, and the United States actually launched significant investigations. The president appointed an opioid czar, and there was a morphine and opium epidemic declared at the turn of the century. Heroin was discovered in England and then again brought to market in Germany close to the turn of the century there, and was initially a cough suppressant, but because it was again more potent than morphine, it was thought that it could be a heroic cure to morphine addiction. So you can see. And so I will tell you that the United States quickly developed a significant heroin problem because heroin does work to get people off of morphine. It's much more desirable. It has much more enjoyable and physiological desirable effects. The United States banned treatment of morphine addiction in 1916, kind of starting towards more and more prohibitionist policies. Heroin was completely banned in 1924. Heroin use continued unfettered. Heroin rates never really changed from 1924 to today, and fentanyl is what has replaced the heroin supply. Fentanyl was first synthesized in Belgium in 1959, was first used medically in the United States in 1968, and almost immediately after its introduction in medical use, it was misused and caused problems with healthcare workers and showed up less than 10 years later in street drug supply China White, I don't know if anyone's heard of that. There's a Tom Petty song about it, but was alpha-methylfentanyl. That was something that caused a lot of outbreaks of overdoses in the 1980s. And fentanyl analogs have been in street drugs in the United States since at least the late 1970s, but continuing up to this day. And so why did I go through all of that lengthy history there? Because we have not learned from these mistakes. And so this is just from May and June of this year, the United States, where fentanyl is already banned for any sort of non-medical use, was once again now doubly banned. They added additional sentencing, additional criminal policies. And so you can see here, multiple groups, Human Rights Coalition, asked politicians to try to learn from the mistakes that we made. And despite that, our president and Congress signed this into law. And so that kind of brings us to where we are today. And so last year in the United States, we lost almost 110,000 lives to drug overdoses. The vast majority of those, more than 75%, was from opioids, and almost all of the opioid overdoses were fentanyl related. That is a staggering number. It is something that sits heavily with me all of the time. And you can see here that this is not something that has been going on for a long time. So the reason that people think that our overdose problem is from the last 10 years, 20 years, 30 years, if you look back to 1999, I mean, 20,000 overdose deaths a year is a bad thing, but it's nowhere near 110,000. And so this is something that is all attributable to fentanyl, and you can see here the rise kind of just happened within the past few years. So even though fentanyl is an old drug, I like this graph in particular because it shows you that red part is essentially all fentanyl. And so even other overdose deaths have probably decreased in this time, but our overdose death rate has gone up strictly because of fentanyl. And so why I'm here today, Scotland, as everybody knows, has the highest drug overdose death rates in Europe, and I see a lot of similarities and parallels in kind of what's been going on. And so there was kind of encouraging press reports from overdose death rates in 2022 that they fell a little bit, but they still remained at near record levels only to the 2 years beforehand. And from what I was able to find, preliminary data from the first quarter of this year shows an increase kind of back to those record levels. And one thing that I have seen in the US is this tendency to portray this leveling off, slight decreases, plateauing as some sort of positive thing, as a victory, even though if you look at those graphs, you can see our overdose death rates remain more than 100,000 lives a year, more than orders of magnitude more than they were within the past couple decades. And so this is not necessarily something that I would consider a victory. And so with kind of one thing that is on everybody's mind, the ban from the Taliban on opium production, will synthetic opioids become a bigger and bigger problem for Europe? And I mean, synthetic opioids are already here, whether it's going to be fentanyl, whether it's going to be nitazines, synthetic opioids are here to stay. And this is something that we've seen very, very much in the United States. Even if you can get other drugs, the synthetic opioids are definitely here to stay. And so this brings me to the misinformation. This is how our news has presented our overdose crisis. Fentanyl is causing thousands of % more deaths. Drug users aren't choosing it, dangerous fentanyl. So it isn't new. This is something that's been around since the 1950s. Why did this suddenly become a problem? Well, because the United States effectively destroyed their own heroin supply, which was largely from northern Mexico. The United States was very successful in getting rid of all heroin that was being imported at the time. Fentanyl, being completely synthetic, can be made without the need for kind of extrajudicial land, tropical weather, all of the things that go into opium and heroin production. You can actually make fentanyl on your own with very minimal knowledge, very minimal tools and skills. I've had patients tell me that they learned how to make it in a bucket in their own home with things that they bought on the internet. I wouldn't recommend that, but it's very easy to do, and so these are definitely here to stay. The problem is that fentanyl, which is another one of the reasons it has shown up, is it's much more potent. So it's 50 times more potent. Most of the nitazines are comparable in that regard. And a lot of the nitazines, too, are old pharmaceutical drugs that have been pretty well studied. And so, for the most part, their potency, their effects are actually very similar to fentanyl. But so this makes it more desirable in the drug trade because you can transport it more discreetly. Fentanyl is actually sent through the mail, but it's also much more easy to overdose. And when you think of black market drugs, measuring them out, weighing them, that kind of thing, not the same process as what goes into pharmaceuticals and pharmacy preparations. And for anyone who isn't familiar with the iron law of prohibition, I don't want to belabor this point, but just the more and more that you kind of criminalize one substance, you push people to more potent things, more dangerous things, and in my opinion, weirder things. And we've seen this across the spectrum of substances, but opioids are a great example, and that's why I wanted to kind of bring up the history of opium to morphine to heroin to fentanyl. And that's where we are today. And misinformation is really one of the biggest drivers of this bad policy. So one of the things that we see in the United States is portrayals like this. This is the Grim Reaper sprinkling fentanyl over a metropolis as if it is just some deadly poison that can be dumped from the sky to kill anyone at will. Our Department of Homeland Security considered classifying it as a weapon of mass destruction a few years ago. This thankfully didn't go through, but our Congress revived this within the past year. It's currently being actively considered and is one of the only things with bipartisan support at the moment. Fentanyl is not a weapon of mass destruction. I can assure you that if fentanyl could be weaponized, the United States would have weaponized it. Every powder is now reported as suspected fentanyl. Every kind of unknown scene, everywhere that law enforcement police go, there is fentanyl. And this brings me to the myths that have come up and become such a big problem. And so this really started back in 2017, which is interesting since fentanyl's been in drugs since the 1970s. But a police officer said hours after he pulled someone over, arrested them for possession of fentanyl, he noticed a little bit of powder on his uniform, brushed it off, and quote unquote felt his body shutting down. The person who he had taken the fentanyl from got 18 months added to his prison sentence for endangerment of the officer. There was no testing done, no confirmation the symptoms were not consistent with a fentanyl overdose, but for whatever reason, that was a viral story and has kind of snowballed into this phenomenon that we see today, where people think that they're overdosing from touching fentanyl. Here's another illustration from the New York Times showing kind of the specter of fentanyl chasing down law enforcement. And so just a few dangerous myths and misconceptions and why these matter. I'll get to it, I promise. One thing I would like to say is that the reason I'm talking about this is hopefully not just to show people how silly this is and how dangerous it is, but the fact that you can make a difference in kind of getting not only good education for yourself, but telling other people that, like, hey, maybe this is something that's totally ridiculous. And so after I've been doing this with fentanyl for about 6 years now, finally seeing kind of pushback and corrective information showing up here. So here are just a few examples. So the main thing is that people believe that they can overdose on fentanyl by touching it. And there's this idea based on the fact that there is a dermal preparation of fentanyl patch that exists. But the fentanyl patch really illustrates how impossible this is. So the fentanyl patch is in a different physical state. It's a liquid rather than a solid. It's mixed with an alcohol into a completely new solution. So it's not actually just fentanyl anymore. And the pharmaceutical industry, with all of their resources, money, the best minds that they could buy, spent decades developing this. And in the best case scenario, to absorb fentanyl through your skin, you can get a 75 microgram dose after 13 hours of wearing that patch. And so that's a dose that nobody in this room would overdose from. And so your skin is actually a sufficient barrier. When I talk about this, I always recommend gloves. Universal precautions are universal for a reason, but fentanyl will not absorb through your skin. So for whatever reason, this myth continues to be perpetuated. And one other thing is to think, if it were possible to just touch nitazines, why would the pharmaceutical industry have discarded them when they could be selling them as easily absorbed opioids? Why would people who use drugs not want things that are much easier to use than going to the lengths of injecting and that kind of thing. We've seen an entire market of scam products pop up in response to this. This is kind of sapping a lot of our resources. So not only is the misinformation distracting our time and attention, but now the money that we could be spending on things like naloxone or recovery resources, that kind of thing, is going towards products like fentanyl-resistant gloves and hazmat cleanups. And this is just from a couple weeks ago. A coroner found a bag of fentanyl on a body they were preparing and called in a hazmat response. And in the United States, every hazmat response runs about $50,000 US just to start. So it's a lot of money that's being wasted. People also, for some reason, believe that fentanyl is getting into the air, so being around it can cause you to overdose. Thanks to the laws of physics, which are laws of physics for a reason, fentanyl does not aerosolize under any conditions found on Earth. And again, if it could, there would be aerosolized fentanyl, I'm sure, as a medical product, or people would be using it in this way. People like to confuse the fact that it can be snorted with the fact with inhalation, which are not the same thing. And so for inhalation to be a problem, and this again would apply to the nitazines as well, because they have very similar physical properties, you would literally have to either be buried in a pile of powdered opioids, or be face down in a pile, or have millions of dollars of drugs around you and some sort of wind tunnel scenario to be able to inhale an amount that would require to overdose. And so that's not ever going to happen. People worry that more potent analogs, carfentanil, the elephant tranquilizer, are going to be a risk as well. And there's a lot of images that go around showing the comparable potency with little vials of powder of how much heroin it would take to overdose versus how much fentanyl, carfentanil. And again, this could very easily be applied to the nitazines as well, but they all have the same physical characteristics. The same dry powder is not going to magically work its way into your skin just the way that other things are not doing that. And there's a very cool case report of an actual veterinarian who was trying to sedate an elephant with pharmaceutical-grade carfentanil, sprayed it in his own eye, and had no ill effects. And so that was a purified form of a liquid carfentanil directly into a mucous membrane, and he lived to tell about it. And this is my obligatory carfentanil joke. So in conclusion, opioids are not going to get into your system unless you want them to, unless you've ingested something. And so we've seen fentanyl show up in everything in the United States. It's in our benzodiazepines, it's in our amphetamines, it's really in everything other than cannabis at this point. And so it is a risk for people who are using drugs. It's a reason that we should care about things like harm reduction and safe supply, but these myths really distract and really create their own problems. But I think if you can learn one thing today from my experience, it's that misinformation is very bad. Why is it a problem if people are more scared of synthetic opioids, if people are more worried, people have increased fear? And so what I've seen in real life is that someone who's experiencing a true overdose will not be resuscitated because no one wants to get near them. So not only are people having these dramatic reactions, if you've seen any of the videos of people claiming to experience their fentanyl overdose, which is likely some sort of panic attack or some sort of fear response, but people who need resuscitation are not getting treated appropriately. People are spending, that one person spent 18 additional months in prison for something that is scientifically impossible. Our resources are being wasted on expensive hazmat responses and other things for, again, a scientific impossibility. So at the end of the day, fentanyl, these synthetic opioids, they are something that we should care about, that we should worry about. They can cause problems, but they're molecules. We can understand them, and we can respond to this in a rational and reasonable way.